7:06 on January 24th. Legislative Council is just going to remind us what H31 is, what we're trying to do, and then we have some witnesses for that we'll hear from.
Great. Good afternoon, Jen Carby from the Office of Legislative Counsel. Here we have H31. And this is an act relating to claim edit standards and prior authorization requirements. You might remember this bill, we walked through it a few days ago, and it was making changes to a couple of provisions that were enacted or amended last year. The first is specifying that when there are certain edit standards about how insurers can edit claims that are submitted for services that have been delivered. There are certain edit standards that are supposed to be applied in a number of situations, but there are some exceptions. And this is adding an exception when adjudicating claims for healthcare services that were delivered outside of this state, unless the payer and the out-of-state provider agree that one or more of those edit standards, and they're in the previous subsection B of the section, will apply. So generally saying, and this is kind of consistent with how it works anyway, is we can regulate what's happening in our borders, and we're not trying to regulate what's happening outside our borders, but certainly there can be an agreement between the payer and the provider that some or all of the edit standards would apply. Section 2 is around prior authorization. And as I mentioned, last time we looked at this, language was enacted last year that would exempt primary care providers, anything ordered by a primary care provider, from a prior authorization requirement. There are certain exceptions for the types of services, but there's also a definition of primary care provider that had been linked to the meaning used by the Blueprint for Health. This strikes that language because there wasn't necessarily consensus about what that meant, and instead says that it means a healthcare provider who is contracted and enrolled with the health plan as a primary care provider. So it's relying on the health plan's definitions and how they determined who's a primary care provider. Section 3 is effective dates. So the first section around the claim edit standards takes effect on January 1st, 2026, because that's when the change to the underlying statute takes effect. So they'll happen at the same time. And section 2 around the definition of primary care provider for prior authorization exemptions would take effect on passage and would need to be implemented by all the health plans as soon as reasonably practicable after that date, but not later than January 1st of 2026. And then the effective date section would take effect on passage.
Great, thank you. Any questions for Jen and all?
Well, no, I have a question. I'm not sure if it's for you or Jen, because you're the expert in this world. I'm just trying to, or not, I'm just trying to make sure. What's the process for 3? Like, how does that work? Section 3 is
Effective dates?
no, sorry, that's, section.
Okay, on page 2.
Back, yeah, thank you. Page 2, line 13, 3.
No, go back up.
Yeah.
So what is the,
Yeah, how does that work? I mean, if I was someone who went out of state, how does that work?
so this doesn't affect your experience as the patient. This is really about the interactions between the payer and provider over payment of the claim and what exactly is being.
I look at it as the claim edit standards that we put in place follows where the claim was generated, what state it was generated in. It was generated in the state of Vermont. And that it doesn't follow where the patient happens to have their insurance. So we'll use an example. If you have a insurance plan and I'll just put Blue Cross Blue Shield of Vermont, and you go to a hospital in New York, that when Blue Cross Blue Shield of, I realize this is a bad example because New York would be administrative, but if Blue Cross Blue Shield of Vermont, when they got that claim from the New York hospital, they would not have to employ the edit standards for that New York hospital when adjudicating that claim.
Okay.
Right, a Vermont insurer does not have to follow the Vermont edit standard requirements for services that were delivered to a patient
Elsewhere.
outside of Vermont. And they're dealing with an out-of-state provider.
Thank you. That helps me.
Okay. Anything else for Jen? All right. Thank you. Emily, you want to come on up?
Good afternoon. Emily Brown, Department of Financial Regulation. So I'll be brief. The department supports these changes to essentially Act 111 and supports H31 and the changes to the claim edit standard as well as the prior auth definition. Happy to take any questions. I have Sebastian here as well if you have broader questions about Act 111, which these relate to. So happy to answer any questions if the committee has any.
I guess I have did Mari? Yep. Guess I have a question if no one else does. I just want to make sure that particularly page 2 or page 3, I'm sorry, line 10, 11.
I'm just going to get to it really quickly. All right, so page 3,
Yeah.
line 11.
Yes. It's regarding what a primary care provider
Yes.
and who this applies to.
Mhm.
I just want to make sure that it's being interpreted
Yes.
in the.
Yep.
Okay.
So this would mean a healthcare provider who contracts with an insurer in the fully insured market. And if they enroll as a primary care provider, the prior authorization standards would apply to them
With that payer.
with that payer. Exactly.
Okay.
Yep. And to note, I think this was already mentioned in prior testimony, but not all health insurers have the same networks or providers included in it. And so that there might be variation among the insurers as to who qualifies as a primary care provider. But that determination, again, will be between the provider who is contracting with the health insurer.
And I'm gonna ask just because I had to revisit 111 a couple times now. Is there anything else in 111 that has proven challenging to administer for your?
So the sections that are going into effect right now, January 1, 2025, are the ones I think that, right, are being implemented. We haven't heard from the insurers of other issues with other parts of Act 111. I think that would be a better question, right, to the insurers who are in the process of implementing maybe the other sections which are coming into effect, I think, beginning of next year. I'd have to refer back to Act 111 to actually know what those are. But we have issued a bulletin guidance for Act 111. We haven't heard any feedback from the insurers about issues implementing it as per the guidance from the department. So at this point, we don't have any other additions that would be needed to change Act 111. One thing I did want to mention, just for the committee's information, is in the effective date, it does mention that Section 2, which is the prior auth changes, shall take effect on passage and shall be implemented by all health plans as soon as reasonably practicable after that date, but in no event later than January 1, 2026. So when we were doing last summer, when we were reviewing the major medical forms, the policies that we approve, the department approves for sale in Vermont, we did require the insurers to put information in their certificates about these new requirements around prior authorizations. So the way it is defined right now in consumer contracts is per the blueprint definition, which was in there last year. So I think that the insurers will be working on implementing this, obviously for January 1, 2026, but I did want to just mention that in the contracts that they have with their subscribers, it does talk about the blueprint definition being the way that the prior auth requirement is exercised. So I think that they're really required per their certificate to follow that with their policyholders. So obviously it will definitely be done by January 1, 2026, but I did want to just bring that up as something that is out there and will govern the contracts with their subscribers at least till the end of this year.
So you're saying that essentially, even if it was reasonably practicable for them to achieve this, they would not be able to implement it anyways because of the contract that
Correct.
covers
Yeah.
plan year 20.
Yeah, because we were trying to integrate as many things as possible into the contracts
Mhm.
because we wanted to make sure that consumers were aware of them.
Mhm.
And this was something that we worked with them on making sure that was in the certificates, thinking that this was going to be the path going forward. So I just wanted to bring that to the committee's attention. So it's full disclosure of what's out there and the information that's out there.
But the language that's in there currently
It's
would not.
completely fine. It doesn't need to be changed.
Change.
Yeah, I wanted to just bring that up.
Questions? All right.
Okay, thank you so much. Appreciate it.
Mary Kate?
Sure.
Question for you. I'm just wondering, is there a time frame on the bill, or there's no urgency, we can just, or do we want it to, is it important to move it through?
I don't, be on the record, I don't think there's any particular urgency. I mean, it's not like the bill H-35 that we
Right.
just.
Yeah.
I just want to understand
affects
what's unfolding here.
rates.
Thank you.
All right, Madam Chair, members of the committee, for the record, my name is Mary Kate Molman, Director of Vermont Public Policy for Bi-State Primary Care Association. I will be very brief. I will speak in support of H31. While FQHCs are all blueprint practices, this change doesn't necessarily adjust it. We do want to support the broader language as was initially intended in the original bill. So we appreciate that change. And we appreciate the committee's work on this very important issue that has affected primary care providers and frankly, providers across the system with the administrative burden and the claims edits. So very brief, support the bill. Happy to answer any questions.
Questions? No, okay.
Sorry that there's not.
Sorry.
Yeah, yeah.
Make it hard. Thank you.
Devin?
Hi, Devin Green, Vermont Association of Hospitals and Health Systems. We also support the bill. We see it as some cleanup. So we do support it. One question, is Jen still here? Okay, Jen, the only question I have is, the date doesn't affect the prepayment claims review are we narrowing the date enough so that it won't impact implementation of the prohibition on prepayment review?
Jen Carvey, legislative council, I believe so. I mean, it's
Okay.
just
Just
amended one piece.
Okay, and that's the only thing going into
The
effect
description of, that was just the description of which section we're talking about
in this bill.
in this bill.
Okay,
We've not touched any effective dates from Act 12 or
Right.
185.
I just wanted to clarify that.
At it if it seems like something else is going on.
No, that sounds great. Thank you.
I think if I'm remembering correctly, we made the claims edits January 1st, 26, except for
That
prepayment.
Yes, so I just wanted to make sure that we were saving that this wasn't changing that.
Thanks for pointing that out.
Thank you.
And Jessa?
Thank you very much. Jessa Barnard with the Vermont Medical Society, continuing on the fairly brief path, make this very easy for you. We support the bill. We appreciate the work with DFR and the payers coming into the session to kind of get aligned on this. I will just flag the implications of basically delaying the effective date of the change to the prior authorization definition of primary care for another here is that there are especially small providers who don't participate in the blueprint, but are primary care providers, and this means they will have prior authorization for another year, and they weren't expecting that. So you may hear from constituents, some lawmakers already have heard from some, for example, smaller nurse practitioner practices, naturopathic practices, who it may be burdensome for them to participate in the blueprint, but they still are a really important part of our primary care system. And this is continuing the length of time they have added administrative burden compared to other primary care providers. So I just want to be really clear about what this is doing. We don't love that approach. Our preference would have been if this went into effect, ideally immediately, if not mid-year, but we understand from the payers and DFR's perspective that that is hard to do and kind of change things mid-contract year. So it is just delaying that change another year, when a lot of primary care folks thought when the bill was passing last session, this was actually more the way it would be applied anyway. That said, we support the bill and appreciate it moving forward. I would flag, you may want to hear from some of the payers. I actually do think there is some time consideration for them for when they need to get their rates and paper, their filings into DFR. So I'm not the one to speak to that, but I think they have some opinions about the time sensitivity need for this bill, particularly on the claims edit piece and the out-of-state sort of adjudication of claims.
Thank you. Any questions?
Thank you very much.
Oh,
I have many questions, but not today. I just have to do something. It's interesting.
Since Jessa raises a good point and everyone was so brief, we do have time, and I do see that there are payers in the room. Would payers like to comment on that? I mean, I know I'm really sorry. It's hard for me to remember hour to hour. You did testify on this last week, right? Okay. Okay. Okay, thank you. But yes, Claire, if you'd like to.
Yes. Good afternoon, Claire Buckley from Leonine Public Affairs here on behalf of MVP. And yes, Jordan SD of MVP did testify remotely on this bill, but since this question has come up about timing, I thought I would just weigh in on that, which is that we absolutely would like you to move this bill as quickly as possible, and do think that there is a timing issue especially with the out-of-state provider piece. The rate filing starts pretty much is happening now, starting to develop them, but the first filing is in May, early May, where you actually, we need to know precisely, our actuaries need to know precisely what the law is in place for the market for next year early. And if we say this bill were to wait until like the end of the session, it would cause a lot of uncertainty and might actually, make the rates different than if the bill were to pass. So we appreciate the fact that this was put on hold for a year last year, so we could work over the summer with pretty much everyone who's in this room on both the bulletin and this bill. And the bulletin resolved a lot of issues outside of this room, but this was a statutory piece that had to come through you. And we would appreciate your swift and quick consideration. Thank you.
Thank you. Sarah, did you want to come up?
I don't need to,
Okay.
I already testified in support.
Okay.
I can be very clear about that.
Okay. And I'm assuming for the same reasons you'd like us to move this as quickly as possible, or
I would think it would be good for certainty, yes, because we're a blue plan, we deal with out-of-state payers in a different way.
that's why I said, as I was saying, I'm like, oh, that's a bad example.
Yeah.
All right, any questions about this? I anticipate we're going to find a very brief time next week to do final markup and possible vote.
That was my only question.
Yeah.
When? I think
Yeah.
that makes sense. Next week.
Does anyone feel as though you need to hear from anyone else?
can we give the 48 out? Can we give the last call? You know, like anyone out there who has
Okay,
any
it's
issues?
all right, it's
you
a
know,
weekend, so people have the
Yeah.
weekend, so it's what, 72 hours?
They're getting extra time.
Yeah, they're
like
gonna
the
get
time
extra
change.
time. And we'll find time in the agenda next week. In fact, I'm actually thinking of a little hole to fill. And we'll revisit this for possible vote. All right? And no one has to worry because I'm already going on record as saying I'll report this. So. All right, I think we're done until 2:00. And so we can have a nice long break. And the committee will be coming back, but we will not be going back on live because of the training that we're doing.